Hello, and welcome to the Chalkboard, a podcast hosted by the Gogebic-Ontonagon Intermediate School District. This monthly podcast shares how the GOISD works to inspire students every day and support the work of our local school districts. I'm Alan Tolpo, your host and superintendent of the Gogebic-Ontonagon ISD. Today's episode features our Health Resource Advocate program. One of our school health resource advocates, Katie Hampston, joins me today. Also with us is Megan Hagan, Director of Student Health and Wellness Services. I'd like to welcome you both to the podcast.
Thank you for having us.
Yes, thank you.
So our Health Resource Advocate program is not a new program. It's been around for the last 3 to 4 years. Could you explain to the listeners what an HRA is and what that stands for?
Yeah, the program really stemmed from COVID. However, we'll speak a little bit more to that later. Health Resource Advocates, you'll often hear them referred to as HRAs. And what they are is Health Resource Advocates. The positions stemmed out of COVID, and we'll speak a little bit more to that. However, we were very fortunate at the GOISD that the two HRAs that we were able to obtain were clinical HRAs. And what that means is that they are both bachelor prepared registered nurses. And that's not something that everybody has across the state.
Okay. And can you explain, as a bachelor prepared registered nurse, what a health resource advocate does and how this fits into our broader school community?
Sure. So we assist with a broad range of health-related prevention and medical issues in our 6 districts that can range from care coordination for students with healthcare needs. And this an example would be medical management plans, emergency plans, nursing care plans, COVID-19 and other communicable disease screening, reporting, and educating. Mental health collaboration with our partners in social work, and then really working to create the whole child support in the school setting.
Right. So this work that you do takes a lot of collaboration. I heard you mention social workers in there, and other school staff. So how do you collaborate with school staff, teachers, administrators to make sure that student health needs are met?
So we cover the 6 districts within the GOISD, and have found being present and working with all of the staff, from bus drivers to teachers to the lunchroom staff, to get to know us and our roles has been really helpful to make connection with school staff. So we also collaborate a lot with our own GOISD staff. I specifically had mentioned social workers before because of the mental health work and physical health and how they connect. Although the collaboration happens daily in different capacities, an example of this would be working with students with chronic illnesses, such as diabetes, that require daily care from a team to ensure the safety of that student each day. Clinical HRAs help with the individualized health care plans, medical care plans, and emergency care plans in collaboration with a medical provider. So we organize these plans out and then educate all school staff that may be in contact or support that student in some way, shape, or form during the day, to carry out those medical and emergency plans in the event that they're needed. And then we'll do this for any kid that has chronic conditions or acute conditions in the school. We participate in READS, IEPs, 504 processes to assist with eligibility needs and the proper documentation and education around that piece.
And all these services happen for students regardless of a family's insurance coverage too. There's no insurance necessary or coverage necessary, I should say, for a student to receive this service.
Correct. And we also will assist families if there's appointments that need to be made or there's health needs to get them connected to the correct resources outside of that school, in our community partners, to ensure that they're connected to the right people, let's say if they don't have insurance.
Okay. That's so important right now, especially in our area of the state where we are somewhat healthcare challenged, particularly in Ontonagon County. So you talked about the work that you do and how you collaborate with various members of a school team. What resources or services can you connect students and families with?
besides our GOISD social workers, when we talk about mental health in the schools, a lot of times we'll see physical health symptoms with our students showing up at our office with typical physical health issues like headaches, stomach aches, and sometimes we can help try to get to the root cause of those issues. So we also collaborate outside of the schools a lot with the Western UP Health Department, Aspirus, Ironwood, primary care providers, and then specialty care providers, specifically mental health providers, community mental health, Copper Shores Community Health Foundation, North Lakes Clinic, DHHS, just to name a few. And then in addition, we're often collaborating and connecting with different specialties in the Midwest based on our medical plans and the schools and needs. So we'll help families connect with those resources depending on the needs they have.
Okay. So it's quite a comprehensive list of supports that are available for students and families if there is a need. You've referred to mental health in our conversation several times. And how do you see your role in promoting mental health awareness and resources within the school setting?
So mental health directly impacts students' physical health. When you talk about the whole body or the whole child care model with health. So physical health is mental health, vice versa. So we can often troubleshoot symptoms and collaborate with our colleagues in the school to assist with the more specified mental health concerns. We can often recognize students who will come to us in the office with frequent physical complaints and help assess what's actually going on. We do not treat or diagnose, but we can help to provide education support and refer to our social workers and mental health providers outside of the school to create a supportive team around our students.
Great.
Yeah. So one thing I just want to add on top of that is we have been really working on our continuum of supports around mental health and having a really comprehensive program available for our students. And I think that bringing in some HRAs really brings, they each bring a very different lens to when they look at situations and kids and just everything that we're dealing with as a team. And I just feel that that unique perspective that they're bringing to the table just meshes really nicely with all of the other educational roles and just makes it a broader continuum support for our kids.
And that's so important, especially as we take a look at educating the whole child. We want to make sure that that full continuum of care is present for them. We mentioned earlier, Katie and Megan, that you don't need to have health insurance to have access to these services. And you had also shared that you can assist families in having access to health services. How do you work to ensure that happens?
So part of the care coordination roles that registered nurses are trained to do and working with connections that both of our HRAs have in our communities, we're able to help families get connected to the right resources for their needs. So we can often assist families to navigate those resources of insurance, dental providers, rides to medical appointments, healthcare appointments, specialty provider connections. If we don't have the answer, we usually have a connection that can assist families to get the assistance that they need. It's really about taking time to meet those families where they're able to meet you, to navigate sometimes those complex healthcare systems. And in our rural area, we try to create more opportunities such as doing flu and COVID testing in our rural schools, immunization outreach clinics partnered with our Western UP Health Department to find unique solutions to kind of fill those gaps.
You already mentioned some of the partnerships that you have with organizations across our region. What are some of the key partnerships or external organizations you work with to strengthen the support system for students?
Western UP Health Department have been strong partners through our start of HRA. Aspirus Ironwood providers who serve our children from primary care providers to specialty to mental health providers, community mental health, They have community workers, caseworkers, and providers that are mental health that we can connect with. DHHS also has a lot of resources available. Michigan Association for School Nurses, we're both part of collaborating with that team. That's a statewide group of school nurses so that we can stay on top of the best practices and have resources for our schools and students. Black Butte is their health clinic, and early on in Head Start, we work with for transitioning those kids with health needs to our schools.
All right. And we mentioned at the beginning of the podcast that these roles have been in existence at GOISD and other intermediate school districts across the state for the last 3 to 4 years. During that time, how have you seen your role change, and where do you see it going in the future?
So HRA started during some unknown times, and we're heavily focused on COVID-19 mitigation strategies and testing. And although these tasks still exist in our day-to-day work, our clinical nursing licenses have also allowed us these roles to become a lot more supportive of our student health needs. So we're seeing an increase in more complex medical needs in our daily life at school, and we're fortunate to be able to assist our school communities in making the process and education around health more streamlined in schools. So our hope for the future is that clinical HRAs, nurses in the schools will continue to grow to serve more students, families, and educators, just to make our school culture better.
Great. It's definitely needed. I always end the podcast by asking my guests a question about the favorite part of what they do. So if you had to identify your favorite thing to do, the favorite part of your job, Katie, what would that be?
My favorite part is probably working and getting to know students that I wouldn't know normally. I've created a couple bonds with staff and students. That's super fun, that you get to know what the actual school community is doing day to day, which I didn't know before.
Okay. And you're a parent too, so you have kids going to school, to the schools in our ISD. So you get to, happen to see once in a while what your kids are up to in the schools that you serve?
Yes. It's nice to connect with the community that you live in too.
Great. Good. Well, that's all the time we have for today's podcast. Our next episode will be posted during March and will include information about the GOISD's Make a Difference Day that will be happening this spring. If you have questions about today's episode, please contact Megan Hagen, Director of Student Health and Wellness, at mhagen, Hagen, at GOISD.org, or by calling 906-575-3438, extension 300. Thank you for listening. Be well and have a wonderful day.